Hello, Dr. Dave Webster. This is part of my ongoing video blog series about the travesty of lack of access to PET-CT in Ontario. Now, in my last video, I had said that I will be giving short case examples to demonstrate the claims I have made about the potential devastating impact that Cancer Care Ontario's actions can have on patients. And I would suggest to you that the most revealing examples to demonstrate the true nature of the healthcare agendas of Ontario's politicians is to consider how they deal with children who have cancer. And thus my first case example, what it means to be an Ontario teenager or young adult diagnosed with lymphoma, subtitled The Knowing and Deliberate Exposure of Your Children with Cancer to Gross Amounts of Harmful and Unnecessary Radiation, which itself can result in more cancer. Now, I hope you're very disturbed by what you see and that you're upset about how decisions have been made about the lack of access for PET-CT when your children with cancer. But remember, this isn't just about PET. PET is just the most egregious example of how critical healthcare policy decisions affecting your children are made in Ontario. And when you have the facts, my goal is that I can get enough people to support my social media campaign to demand that the Ford government will allow Ontario patients to have access to 2018 levels of advanced medical care, not like we're living still in the 1990s, as it turns out. Now, this is very timely because it just turns out that unfortunately a recent announcement about Canadian snowboarder Max Parrott is diagnosed with Hodgkin's lymphoma. He's about 24 years of age, and he lives in Quebec. Now, it's fortunate that he does live in Quebec and not in Ontario. Although they will have similar access to treatments, it turns out you will see why I have made the statement. And if you have cancer, more importantly, if your children have cancer, you may want to leave Ontario and, for example, consider going to Quebec for your child's investigations and management. Now, Quebec has the highest utilization of PET in Canada. One of the reasons is that the Quebec government was successfully sued by a cancer patient because of their lack of access to PET. Now, Quebec has the same number of PET cameras as Ontario, but they have only half our population. Yet they scan some 3,000 patients per camera per year, whereas in Ontario, we are only allowed about 800 patients per camera per year. But the bad news for your children, as you will see, is that up to 90% of the OHIP indications are the exact opposite of the World PET Expert Body of Opinion. This was a 16-year-old male. He presents with a large painless mass on the left side of his neck, and in this age group it's almost certainly going to be a lymphoma, which is a cancer of the lymph nodes. Now, in Ontario, it's compulsory. The patients must have a diagnostic CT with or without iodine contrast, which they may react to before being considered for a PET-CT. The question is why? Now, here's the diagnostic CT. This is what we call the coronal plane. Here, as you can see, this is the neck and so on, but this is the palpable mass, the lymphoma in the neck and in the chest. Now, a diagnostic CT is equivalent to about 300 chest x-rays worth of radiation. Sounds like a lot of radiation, but it's quite acceptable if there's a proper indication to doing that diagnostic CT. The question is there a proper reason? Now, a PET-CT also has radiation. It's similar to the CT exams, but fewer are required, as you will see, to manage the patients, and the reason is that the PET-CT contains critical information on the metabolism of these masses, which simply is not available on the diagnostic CT that are performed. Now, I keep talking about FDG PET scans as a PET-CT. The CT is done with a low radiation dose CT and no IV contrast. The total radiation dosage exposure, therefore, is about the same. But I'm just going to talk about the PET images because that makes it easier. So what you're looking at is an image of the cells metabolizing glucose, this being the heart, liver, normal tissues, and brain. These are the cancers here. These are some of the findings that were found on both the diagnostic CT and the PET-CT, but remember this that his PET scan is only allowed after the diagnostic CT. But keep in mind, the PET-CT has identified all the critical information, as well as, in fact, more information than the diagnostic CT as possibly can supply, and it has most accurately staged this patient and will also serve, as you will see, as the best baseline for treatment monitoring to assess the impact of therapy. So the question is, can anyone think of a reason why it is compulsory for your child to have this CT exam? Most importantly, what about the harm and risk to your child from that diagnostic CT? And those risks and complications are, in in fact new cancers caused by the radiation itself. Now, this is a huge concern beyond Ontario's borders. For example, this is the American Journal of Radiology, and this is a paper that is entitled Projected Effects of Radiation-Induced Cancers on Life Expectancy in Patients Undergoing CT Surveillance for Limited Stage Hodgkin's Lymphoma. In other words, a new cancer as a result of radiation exposure from the diagnostic imaging used to manage your child's cancer. This is another one called, from the World Journal of Gastroenterology, Radiation Risks Associated with Serial Imaging in Colorectal Cancer, and Should Patients Worry? Now, and their conclusion was that 34 of 36 studies showed a positive association between ionizing radiation from medical imaging. So now let's move on to the treatment of a young man with lymphoma. This is typically going to take place with 6 cycles of chemotherapy followed, and also with some radiation. Now, what the rest of the world has understood for some time, only recently available in Ontario, is that after 4 out of 6 cycles, an FDG PET scan can demonstrate whether the tumor is responding to treatment, and in fact, in some cases, you can determine a complete response, and the patient may not need more chemotherapy, since to continue the therapy now would carry more risk for the patient than the cancer itself. However, in Ontario, before you can have that FDG PET scan at 4 cycles, you must have another diagnostic high radiation dose CT. So why would that be a problem? Well, here is the pre-therapy therapy on a diagnostic CT in a patient. This isn't the same patient, but same disease, lymphoma in the chest here, as you can see. This is after 4 cycles. This is a diagnostic CT. Now, there actually is absolutely minimal change in that diagnostic CT. There can't possibly be, because of the very nature of the response on the CT. Of course, the biggest question is for this young man is, do I need 2 more cycles of this toxic chemotherapy? Now, let's look at the PET scan. This is the disease, the heart here. This is before we start therapy, and this is after 4 cycles of therapy. There's the masses on the CT, but notice there's no metabolic activity. This is now successful treatment and basically scar tissue. So, does this 24-year-old male need 2 more cycles of toxic chemotherapy? What do you think? So, the reason the patient must have a compulsory diagnostic CT in Ontario would be, so understanding this, you must understand this, that let's assume now that the patient has had complete response, and you're now going to follow the patient to see if they have recurrent disease. In Ontario, they will now only be allowed to have serial CT exams. They will only be allowed another PET CT if the CT is inconclusive. And remember this case here, CT grossly abnormal, the PET scan normal. Now again, both the diagnostic CT and the FDG PET CT have a similar radiation dosage to the patient. But as you can begin to guess, the patient will require far fewer PET CT exams and therefore less overall radiation exposure, since it not only provides size information, which we have in the CT portion of our PET CT, but that critical glucose activity of any masses which persist on that CT. Yet, I have seen similar patients that have had up to 30 and counting CT exams. Now that's the approximately 300 years of background radiation exposure to these patients. So it becomes pretty clear the CT isn't being done for the benefit of the patient. Now maybe it's time to ask the proper questions, because everything's about politics and money. Just who is benefiting financially from exposing your children to unnecessary and harmful radiation? Now, the reality for these young people with cancer living in Ontario is they will have a very good chance of surviving their lymphomas, just like in Quebec. But within a very few years of finishing their cancer therapy, they will now have to be screened for the development of new cancers from the high radiation dose diagnostic CT exams. And if your child is a female, they will have a particularly high risk of developing breast cancer. So perhaps now you have a better understanding of why I have said, if you are diagnosed with cancer, and now you may realize more importantly when it's your child that has been diagnosed with cancer, you really should consider leaving Ontario immediately. Now, you may also be wondering at this point why your child's oncologist is just ordering these diagnostic CTs and not the PET CTs themselves. You may want to watch my previous video if you've seen Ontario oncologists, friends or foes of the patient. Clearly, the most critical question now for parents of children with cancer is you need to seriously think about the impact on your children from the deliberate actions of Ontario's politicians and their medical experts. You need to understand that critical healthcare policies affecting your children with cancer are not necessarily based on the methods of science. One of the world acknowledged experts in PET and respected men in dealing with medicine and cancer patients is Professor Rodney Hicks from Australia. And in 2017 he said, and I quote, "Ontario has the most egregious and politically motivated agenda against PET, and of course read your children with cancer, in the world." Now, if you're alarmed about what you're seeing on this video, you can find more facts and information by visiting my website and social media sites. If you want to contact me personally with some questions, there's my email address. Now, there will be no points for guessing that these facts will be of absolutely zero interest to our most trusted professional journalists and news anchors. How do you think Ontario's politicians have been able to get away with what they're doing to your sons and daughters for all these years? I need you to use social media to get the facts and information out to as many people as you can. I also need you to email or phone your MPPs and demand they explain why Canadian and international medical experts have been condemning what Ontario has been doing to cancer patients like your children. Way back in 2005, these claims were being made. The only way your children with cancer will have access to 21st century levels of advanced medical care, and most importantly, oncologists who are not working on behalf of Cancer Care Ontario, is if we generate a groundswell of public support and demand that the Ford government publicly defend their healthcare agenda and allow your children with cancer to finally have access to the accepted world standards of imaging management of their cancers. Thanks for listening.